Hey guys, it's Dr. Justin Marchegiani here. Today's live Q&A talk is going to be on stomach acid and skin health. Typically, the rule of thumb is your skin is a good measure of what's happening on the inside of your body. On average, it's a pretty good rule of thumb. If we have poor digestion, if we have fungal overgrowth, if we have bacterial overgrowth, these are all going to be stressors, and a lot of times they're going to be manifested through our skin, through detoxification of whatever debris or stress is inside that our body is trying to get out through our kidneys, get out through our liver. It's also going to use our skin as well, right? Our skin's part of the biggest organ system in the body called the integumentary system. And one of the biggest stressors, if we're not digesting and breaking down our food properly, that's going to be a stressor. We're going to have putrefied proteins in the small intestine. A lot of times with poor protein digestion, we're going to have excess ammonia overgrowth. And we're going to have that from a lot of times dysbiotic bacteria and just protein kind of rotting and putrefying, so to speak. That puts stress on our body. We have to get rid of these things. So we have to have good stomach acid levels to break down protein, to get these food components down to their smallest property so we can assimilate, absorb, and utilize it. Just because we eat it, it's not a guarantee that it's going to get absorbed. I had a patient before this video who had didn't have great success on an autoimmune template in the past. And we went back and we looked at her, her dietary template, and she was higher fat and protein, and she does better when her carbs are up a little bit higher. So what we're doing is we're shifting, we're adding more HCl, more bile salts. And of course I dug in, she didn't have a gallbladder and her stools are floating. So what does that mean? Well, number one, we got to get bile salts up. We got to replace what's missing based on the surgery. Number two, we got to get HCl up as well. And that's going to make a huge difference. And I guarantee we're going to be able to shift those macronutrients, and we're going to see a big improvement in her digestion and also her skin health too. So having good acidity is going to help. One, it's kind of like bleach on the dirty picnic table. Having good acidity in there is going to basically lower that pH. That nice low pH is going to, it's going to make it harder for not so nice guys, bacteria and foreign invaders to grow and hang out. Number one, it's like sterilizing the dirty picnic table, right? Number two, it's going to help lower that pH and activate proteolytic enzymes. A lot of enzymes in our gut, especially the stomach, are pH sensitive. So we have to bring that pH down. So if we're stressed, right? If we're stressed, we're not going to be able to secrete enough acid. If we're drinking too much water, if we're on the go, if we're not chewing our food up, we require more acidity, because that acidity kind of gets neutralized a little bit when it starts attacking food. So we need more acidity. And if we're chewing our food up, if we're not chewing our food up well enough, we're not going to have a lot of surface area for the HCl to work and to activate enzymes as well. So we need to make sure we have good acidity. And we need good parasympathetic nervous system tone or response, because that keeps the blood in the core, that keeps our body secreting digestive juices, that keeps the blood flow here, and it prevents it from going to the arms, to the fingers, to the hands to fight and flee and run, essentially. So we need to have good digestion. Also, a lot of good fatty acids. Like if you look at some of the research in the earliest part of the 20th century, cod liver oil was used to help improve skin health, right? So good healthy fats are really important, especially good omega-3s for skin health. Good fats bring hydration to skin, and we need good acidity to start that domino rally of good digestion, right? Good, nice, increased acidity that lowers the pH, right? pH between 1 and 6 is acid, closer to 1's more acidic. It's a logarithmic essentially scale. So 1 is 10 times more acidic than 2, than 3, than 4, than 5. So it's 1 and 2 are much more acidic. So we want to get that nice low pH that's going to activate our pepsin, our proteolytic enzymes. It's going to trigger good bile salt production. It's also going to trigger lots of lipase as well to help break down and emulsify that good fat. We need that good fat for our cell membranes. We need it for our hormonal building blocks. If we're ketogenic, or if we're shifting our metabolism to be more of a fat burner, we want to be able to access that good fat and not have it just go out in our stool. I can't tell you how many people I know that practice the ketogenic template, but then we'll look at their stool and we'll see a ton of steatocrit. All that fat's coming out in their stool. They're not even absorbing it or assimilating it. So we got to make sure we're able to break down that stuff and be able to utilize it. So we talked about HCl for protein digestion. We talked about it for fat digestion. We talked about how fat is really important for skin health and also good beneficial bacteria, right? If we don't have good acidity, we're going to tend to have a bacterial overgrowth. That's a hallmark of bacterial overgrowth is typically we're going to have lower stomach acid levels, meaning we're not going to have adequate amounts of stomach acid. So it's a good chance that we're going to have a lot of dysbiosis happening, bacterial overgrowth. That's going to create more stress. And a lot of that too can impact motility. When we have poor motility from not enough stomach acid, or the not enough stomach acid leading to bacterial overgrowth, or SIBO, that's going to slow down motility. When we have slower motility, we can start to have something called auto-intoxication, where we start to absorb a lot of our fecal debris, like a lot of those toxins in there. We're not moving it through that 16 to 24-hour time window. We're going to reabsorb that toxin. And guess what? We're putting more stress on our kidney, our liver to excrete it. And we're going to use our skin as a means of it. And of course, food allergens too, right? Casein, dairy, gluten, refined sugar, all these things are going to have a big effect. The more we have a harder time breaking down gluten or breaking down casein, then the more detrimental gluten is. So we'll give certain enzymes, higher enzymes, HCl, we'll even give dipeptyl peptidase 4 enzymes to break down the casein and to break down the gluten proteins. The more broken down they are, the less deleterious they are. It's not an excuse or a license to consume these things, but for patients that are very sensitive, where one exposure could set them back for days or weeks, we'll give dipeptyl peptidase 4 enzymes when they're going out to eat or they're eating any kind of questionable food. Ideally, we don't want to be consuming it, but we're just kind of protecting against maybe the exposure that may happen. Hope that helps. All right, so we dove in, we went deep in, and a lot of times the hidden issue is with chronic low stomach acid, there may be an infection. So you got to look deeper at potential infections. HCl, good beneficial bacteria, addressing bacterial overgrowth, food allergens, and then, of course, good digestion of fats and proteins. Those are our 5 key steps here for optimizing skin health through good stomach acid level. So again, we're going to go transition here. Not a lot of calls like this on YouTube where we do a live talk and then switch into a Q&A. So I'm going to go down the list here. I'm going to hit a lot of the questions that are pertinent to this area. So try to keep your questions pertinent. And again, give me a thumbs up if you like it. Put down below in the comments what you like about it. Let me know future topics. I really want to provide lots of amazing content. So give me your feedback. I'm totally listening. All right, let's go dive in to my question list. What do we got here? All right, let's go to the top. Hey, everyone. Appreciate the thumbs up here. So if we are stressed, we need even more HCl. Yes. So of course, like the goal is be zen, right? Deep breaths, nasal breathing, that increases the parasympathetic nervous system. Try to be grateful even when you're at work and you're stressed. If you have a minute or two, just couple big nasal breaths, find something in your life you're thankful for. That gets the parasympathetic nervous system going. But I think the most underrated supplement out there is hydrochloric acid. And if you want to pair it with its sister enzymes, that's perfect. Because if you're eating a really good diet and you can't break it down and assimilate it, the foods that you're eating are going to be a stressor on your body. So that's huge. Kim writes in, stomach reduction surgery gone way bad. Oh, so what was your question? So I'm sorry to hear that. It sounds like maybe a gastric bypass or something. Can you tolerate HCl? Can you tolerate enzymes? Follow up with a question. I'd like to help you out tonight. Coals of Fire writes in, how long would you suggest someone to supplement with betaine HCl with pepsin while dealing with their gut issues? Anywhere between 3 to 6 months. I always tell patients, number one, let's get the infection eradicated before we deal with it. But number two, after like about 6 month point, I like to utilize HCl as needed, meaning it's going to only be used when you're on the run or you're eating when you're stressed or you're out to eat, having a bigger meal or having some questionable foods. In general, we don't want it all the time, but I want to make sure that really good organic meal that you're eating is digested, assimilated, and absorbed. So we got to weigh that out. That's more important to me. Matthew writes in, hey, Matthew, hope you're doing good. If you have H. pylori and it's neutralizing your stomach acid, why bother taking out HCl? Won't it get neutralized? Well, I mean, not necessarily. It's not like if you're not making enough HCl, right? Or if H. pylori is coming in there and is producing urease, and urease is taking urea and spitting out ammonia, it's, let me just give you an analogy. So let's say you have this much ammonia. It can only neutralize so much acidity. So you can overpower the ammonia by just adding more and more HCl in there, right? So it's still going to be better than not. If you look at the overall bolus amount of your pH, you're going to be able to lower your pH more by doing stomach acid. But in the end, you still want to get rid of the H. pylori. So you want to do it on both sides. Some people aren't ready. That's why in the first 2 hours, we remove the bad foods. we replace the enzymes and acids, but it's still going to be better than not. And we can overpower the pH raising effects of H. pylori with HCl while we get the gut ready to do killing. What brand of cod liver oil do you recommend? Is Carlson's Labs good? Yeah, Carlson's is great. I like Carlson's. I take Carlson's. I have it in my fridge. I also give Carlson's and Nordic Naturals to my son. I like it. Amelia writes in, better to go for monounsaturated fats like olive oil or ghee or coconut oil or tallow. Okay, so monounsaturated fats are going to be fats with only one double bond between the carbons. So those fats are going to be like, I think avocado oil and olive oil will be monounsaturated. Your polyunsaturated are typically, there's at least 3 double bonds, hence omega-3, 3 double bonds. That's going to be your fish oil. And then again, your omega-6s, that'll be your refined nuts and vegetable oils. And your saturated fats are going to be your ghee, your coconut, your grass-fed butter, and your animal products, your tallow. Let's see here. Amelia writes in some more HCl enzymes to help speed up the food breakdown and digestive process. Yep, that's definitely going to help. Where does magnesium play a role? Magnesium is not going to play much of a role in the digestive process. I mean, it helps with over 1,000 different enzymatic roles in the body. It's a natural beta blocker. It helps relax the heart. It helps with blood sugar metabolism. It plays a role in relaxation and coming out of that sympathetic stressful tone. 1,000 enzymatic roles in the body. So it does a lot of things, but it doesn't have a major effect on digestion. But we need good acidity to be able to break down and absorb, and what they call it ionize, to get those minerals in our bloodstream. Now we'll use, like in my line, we'll use magnesium minerals that are bound to amino acids for better absorption. So that helps a lot. Oh, awesome, Amelia. I know we chatted today. Very good. I'm glad that you're excited to start the test. I'm excited too to see what's going on. And thanks for coming on the YouTube video so soon. That's great. Bridget writes in, is baking soda a good means for checking stomach acidity? In my digestive support guide, I'll use baking soda only if patients do it too much, meaning if they do too much acidity, we'll throw some baking soda in. I think you're talking about the test where you'll start giving baking soda and you'll start seeing when like burping or bloating or like poor digestion happens. I typically don't do it that way. I'll do the HCl up and see if digestion gets better. And then if warmness or acidity or burning starts, we'll back off by 1. But I'll typically use baking soda if we go too high, or if someone, goes too high by accident, for instance. Let me hit the pause button on YouTube and go over to Facebook real quick. Susie Norris writes in, I have granuloma annulare rash. That's autoimmune. I'm familiar with that condition. And I clean up my diets more. The more I clean up my diet, the more rashes I get. Any clue what's going on or where the rash comes from? So I'd want to know what your diet was and how you're cleaning it up. So if you're eating more protein or fat, maybe it's the poor digestion of that protein or fat. I want to know specifically what you were eating and then what you consider to be cleaning it up. And I want to make sure that you're able to digest that food. If you're not able to digest it, it could be a stressor on your body. Okay, here, let me keep on rolling, y'all. Ty Nguyen writes in, Dr. J, I'm taking Sovereign Silver 1 teaspoon 3 times a day to kill parasites. Will that affect my stomach acidity and gut bacteria levels? Well, I don't think it will lower your stomach acid levels, number 1. I think that dose is probably too low. I'd go up to a tablespoon dose, personally. And again, 3 teaspoons equals 1 tablespoon. That's my opinion. And will it affect your stomach acid levels? No. Will it kill gut bacteria? Yes, it will. What's the max HCl you can take? I typically lean into the area of 3,000 to 5,000 milligrams of HCl, which is typically 5 HCl capsules at 600 milligrams each in my line. I've had some patients go up to 20 HCl capsules and do amazing with it. I typically do not recommend going higher than 5,000. When you have acidity in the stomach, your pancreas has to pump out a whole bunch of bicarbonate to neutralize that chyme, which is all the mixed up food with stomach acid in the stomach. When it goes into the small intestine, that pancreas has to go into overdrive and make a ton of bicarbonate. And if there's not enough bicarbonate there to neutralize that acidity, you could get a peptic ulcer. So I always get very concerned about that. My typical limit is 5 capsules of 600 milligrams of HCl per meal. And we may go up a little higher. I always like it to be sandwiched in the middle of that meal. That way it's not at the bottom of the gut lining or at the top of a big meal, stretching up and touching the esophagus. Dr. J, Audrey here regarding drinking later, which is the best for digestion? Hot water, warm water, room temperature, cold water. For some reason, I really crave ice water. So in general, if you're drinking water that's colder, it may stay in your intestines longer because it has to raise that water up to room temperature. If it starts moving that water down the intestines, it could easily start to shiver and disrupt peristalsis. So more than likely, if you drink a lot of cold water, you'll feel it in your stomach more before it goes down. So room temperature water is the best to kind of get in your body faster. But in general, of course, if you have drinking ice water and you're just sipping it and you're not downing it super fast, it's not a big deal. I don't have a problem with that. Best way to incorporate bile salts with HCl and enzymes. So in my line, we have 3 separate products for digestion: HCl Supreme, just HCl, Enzyme Synergy, just various proteolytic and lipolytic enzymes. And then, of course, we have bile salts with the supporting herbs for the gallbladder, liver function, and also herbs that thin out bile like phosphatidylcholine and beetroot. And again, we'll dose those individually. As patients get better, I have some combo products, but the combo products that have everything combined, I don't quite have the freedom to move those levers and address things individually. Does heavy metals affect stomach acid levels? Well, maybe, because it could be a stressor on the gut. I know mercury can increase leaky gut issues. So I would say if it creates inflammation in the gut and it increases gut permeability, that's going to activate the sympathetic nervous system, which can definitely lower HCl and enzyme secretion. Amelia writes in, yes, I was going to clarify which are better to incorporate for digestion. Do you prefer more olive oil or coconut? Just curious your preference. Coconut tends to need less bile salts to digest, so I like coconut first, and it's also saturated, so it's better for cooking. Olive oil is good on your veggies, though. If you're doing like a salad, you can mix that with some nice apple cider vinegar and maybe a little bit of a mustard and blend it up, and it works great. Excellent question. Giordana writes in, my husband's on keto and struggling to have regular BMs and taking him long to pass it. Just bought him HCl. He eats organic and drinks lots of water. We're tackling candida now. What will we do next? So 6 R's, remove the bad food. So if he's doing keto, he's probably okay. Where people screw up on keto is they do soy proteins, or they'll do too much dairy or the dairy in general, the caseins or the nuts. So be careful with the nuts and the dairy, cut that out. And I would up the HCl, up the enzymes, make sure his stools are sinking and aren't floating. If they're floating, especially when you're keto, eating 75 to 90% or 80% fat, you may need some extra bile salt too. Keep an eye on that. First hour, remove the bad food. Second hour, replace enzymes, acids. Third hour, repair the gut lining and the hormones. Fourth hour, remove infections, candida, parasites, bacteria. Fifth hour, repopulate probiotics. Sixth hour, retest. Okay. Beauty Queen writes in, what supplements are good for MTHFR? What brands are good? So, I mean, you want to look for methylated B12. You want to look for activated folate, LMTHF folate, or a calcium folate, a natural folate blend. In my line, we have a product called B Vitamin Synergy that has the activated B6, activated folate, activated B12. There are a lot of other companies out there that have good folate, B12, B6, choline type of methylating support. But mine's the B Vitamin Synergy. Ben Lynch has some at Seeking Health too that are really good too. Rhonda writes in, lots of burping after meals, even after drinking water. Would this be low stomach acid or bacterial overgrowth? So you're saying that you get burping even after drinking water? So the drinking of the water could make it worse, right? Water's got a pH of 7. It also dilutes enzymes and acidity. So it's possible the water could be making it worse. So I would get rid of that and see what happens. Gabe writes in, if I have low stomach acid and assume I don't use enzymes or chew long, do you think that the food will sit in my stomach before it moves all the way down? I did a 16-hour fast, felt a bit better, but very mild symptoms. So in general, if you don't, I mean, it just depends on how good or how well your body's enzymes and HCl systems are doing. There's a natural propensity over as you get older that enzymes and HCl decrease. This, if you look at Dr. Jonathan Wright's book on why you need stomach acid, he has a chart in there that talks about HCl dropping as you age. And we know enzymes also drop as you age. One of the theories of cancer is enzymes are really protective against cancer. And it's really interesting. There's a point in a pregnancy when you're growing a baby where the mother's immune system shifts and doesn't have to protect the baby as much. And supposedly that's at the same week the pancreas forms, something to do with the enzymes having a protective effect on that. So enzymes and HCl are connected and go down as you get older. Let me see if I got any questions on Facebook here. Sorry, guys. It's on my small phone, so I got to like really kind of squint here. I think I hit it all here. Okay, Susie writes in, paleo, gluten-free, lots of food, fats. And what's the root cause of the rash? Could be some gut issues. I want to know if you're eating more fats and more proteins when you start eating more healthy. If you are, I'd want to up the HCl and the enzymes. I'd also want to know how your stools are doing. Make sure they're floating. Make sure there's no undigested food particles. I also want to make sure you're cutting out nightshades if you're having all these degenerative arthritis issues. And I'd also want to make sure your gut is clean. Desiree writes in, hey, Desiree, hope you're doing good. How do you feel about MagnaWave therapy? Do you use a magnetic field to restore and reactivate cells? I think there's something to it for sure. I think there is. I mean, I have like a couple of magnet things I put on my phone to neutralize EMF. I've seen some muscle testing respond really well with magnets. I'm not sure, like, people will sell them and they'll kind of like make it like it's this big thing. I'd put it lower on the priority list, but I think it's a cool tool to have in your kind of like, natural medicine tool belt. And I'd be curious to know more about your experience with it. You're welcome, Susie. Keep me posted. Let me keep on rolling, guys. A lot of questions. I love your activity tonight, y'all. Creative writes in, thank you for your time, Dr. J. These live streams are a goldmine. Thank you so much. I really appreciate it, guys. Thank you, Bruce. Amelia writes in, thoughts on ACV. Why take HCl in the middle of the meal? Now I wonder if my 1200 HCl at meal is enough. ACV, apple cider vinegar, right? That's acetic acid. It's a pH of 3.2. Like ACV is like the training wheels, right? It's the training wheel. It's not going to have as much bang for your buck with acidity. HCl is essentially trimethylglycine, right? And it's got a higher level of acidity and it's a little bit more therapeutic. So if you're doing 1200 HCLs, that's like 2 capsules. So follow my digestive support guide, Amelia, which is it's linked on your protocol sheet under the digestive section. Click that and you'll get access to my instructions and my video on how to taper that up. But essentially, you're titrating up one at a time. Take it in the middle of your meal. Any burning or warmness will back off by 1 capsule. And of course, it's dose dependent, right? If you have it with like a light chicken and a salad versus a big ribeye steak, right? It's kind of dose dependent. So use that kind of common sense with it. Beauty Queen writes in, is it good to drink lemon water first thing in the morning? Yeah, I have no problem with that. A little bit of lemon water, some sea salt. I have no problem with that. It's really good. Basically, the acidity is very good. I know with apple cider vinegar, it has some effects on flushing out guanidine, which is a metabolic byproduct of protein digestion. IKO writes in, still getting burping after meals, even with finding my HCl max, which is 4 HCl pills. All right, good. So next is get enzymes going up there. And how do your stools look? Are they floating? Are they sinking? Next step is got to test your gut. Could be infections. Again, HCl and enzymes and even chewing your food really well may not be enough. And then after that, we want to look at fermentable carbohydrates, H. pylori, a lot of other things, but you got a couple of things to start with. Amelia writes in, should you take HCl only if eating protein? Yes, but you should be having protein and fat at every meal. The only exception I'd say with protein is if you're doing a protein powder that's kind of already broken down, not going to be the same thing as like a protein steak or protein in some fish. Rhonda writes in, the burping is after drinking water first thing in the morning, usually 2 glasses. Oh, okay. So, and then how long do you eat after that? Could be a little bit of gastroparesis. I'd be curious to see how you do. Maybe put like a little bit of lemon or lime in there. Does that change it at all? Hard to say. I want to know how you do with the digestive side and work on HCl with your food. So how do you do with the food? I'm curious. Giordano writes in, daughter has eczema, dairy-free with some success, but nothing else has helped. She takes bone broth, glutamine, zinc, magnesium, no gluten for 2 months. Didn't help. What do you suggest? She needs to do an autoimmune paleo. She needs to do grain-free. Anytime I hear gluten-free, I think, oh, I can eat oatmeal. I can have corn chips. I can have rice, right? So I get concerned with it because those are all brothers and sisters and aunts and uncles of gluten. And if you have a sensitive immune system, you can still react to them, right? There's kind of like a family resemblance. You can kind of like, oh, I can kind of see you and your cousin, right? It's kind of like that with your immune system. So, and you got to have the digestive aspect good too, because if your gut's really stressed, there's probably some infections there too. But start around an autoimmune template and then get the HCl and enzymes going. Amelia, you're totally welcome. And can you talk about iodine at all, or another day? So, I mean, with iodine, I mean, it's helpful. Like you have, it's an important mineral, I should say halide, right? Seventh table on that periodic table elements, and it's important for making thyroid hormone. It's the building block. It's the T, or it's the T in the T4 or T3, the active thyroid hormone. The T4 is the 4 molecules of iodine. The 3 is the 3, and it's important for that. It's also really important for breast tissue and prostate tissue. It's the issue in functional medicine where some people are like on the super dose side, some are on like the RDA side, RDA being like 150 to 250 micrograms. So I tend to say, okay, let's supplement the RDA. Let's make sure you're eating it also in your food. Let's also make sure you're getting enough selenium, because with iodine, you also get hydrogen peroxide metabolism. And if you go too high, it can exacerbate autoimmunity. And hydrogen peroxide is a little bit inflammatory, but selenium helps neutralize it. Deborah writes in, sorry to sound silly, but what is HCl? HCl is hydrochloric acid, molecule of hydrogen bound to a molecule of chloride. And it has a very low pH, right? pH scale is 1 on the pure acid side to 14, which is pure alkaline side. Water 7 right in the middle. So when we talk about HCl, we're in that 1.5 to 2 kind of pH world. And that pH is really important because enzymes in our body are very pH sensitive, and we need good enzymatic production. We need good sterilization of our gut. And our gallbladder and our pancreas is also very pH sensitive. So we need HCl. It's that first domino to knock down that digestive cascade there. Kathy Turner writes in, hey, Kathy, how you doing? Good to see you. If you have a question, let me know. Let me see here. Giordano writes in, I have stomach pain when I wake up and randomly during the day. What could it be? It's about 5 times in the last 2 months. Digestive system functions very well. I want to know, what do you eat first? Number 1. Number 2, how often do you have a bowel movement? There's a lot of questions I have, but I want to know where your diet's at and how often do you have a BM? Because of course, if you're not passing at least 12 inches of stool every day, we got problems. Okay. Aaron writes in, self-diagnosed Morgellons. So Morgellons, I think, is like with the creepy crawlies under the skin, right? Sometimes that can be parasite infections too, and just your immune system just kind of being jacked up by underlying stressors that can cause your immune system to be just oversensitive, right? Like I have my watch on. If my immune system is chronically sensing every bit of clothes touching my skin or watch, your immune system, right, your reticular activating system kind of calms things down, so you're not feeling every sensation over a period of time. But with Morgellons, you're hyper reactive. You feel like there's creepy crawlies everywhere. And of course, we look at chronic inflammation, and the question is, what's it causing it? Food's got to be right. Infection's got to be right. Digestion, absorption's got to be right. Elimination's got to be right. And then, of course, hormones, mitochondria, all of that has to be right. So we'd have to do deeper testing in those areas, Aaron, to figure out what's going on. Amelia writes in, so my blood test came back non-detectable levels of iodine. So with iodine, the best way to test is an iodine loading test. So what you do is you take 50 milligrams of iodine, you do a load, and you see how much actually gets peed out. So the more that gets peed out essentially means the less your body needs. But in general, I typically just keep within 3 to 5 times of the RDA for iodine. All right, let me keep on rolling here. Desiree writes in, best supplement for building up tendons, ligaments, cartilage. I've worn out cartilage, ligaments behind the kneecaps. Can that regrow on its own? Yeah, so collagen is really important for that. So collagen is super important. There's a product by Thorne Research called Traumagen that's really good. It's got a lot of minerals, right? Manganese, zinc, obviously protein, collagen, hydroxyproline, proline, excellent things. And then, of course, your good minerals. Traumagen's a pretty good baseline. If you look at the minerals in that product, it's got a lot of the building blocks for ligaments. And then just getting good collagen, like with my collagen, there's ligaments and tendons in there. So you get a lot of those building blocks in those amino acids, and then you take it in. That's helpful. And then, of course, if it's really foregone, meaning you have significant tears, you can always do stem cells to stimulate that as well. But you want to get to the root cause of why those ligaments and tendons are are stressed. If it's a trauma, okay, fine. If it's a chronic repetitive stress trauma, you want to fix why your muscles aren't absorbing force well. And I know with your job, Desiree, that's a big stressor on probably, your joints and such. All right, a couple more questions, guys, and we'll finish up. I got dinner waiting for me. I got a nice kombucha on ice as well. All right. You're welcome, Giordana. IKO writes in, had stool test, no infection. Stool sinks, but greasy. All right. So we're not digesting fat. Probably a lot of wipes to clean up afterwards. So probably not breaking down fat. Replacing HCl and enzymes now. I have high zonulin. That means leaky gut. Zonulin is a protein that goes up with leaky gut. So on carnivore diet now. Good. So you got to get HCl, enzymes, and bile salts, and you got to make sure, ideally less than 5 wipes, ideally less than 3 to clean up after a number 2, and ideally you shouldn't have skid marks on the toilet seat. The only exception is too much MCT oil in your coffee will do it. Giordana writes in, how much iodine would you recommend for estrogen dominance? So iodine can help with estrogen metabolism. It helps convert estradiol to estriol, which is a stronger estrogen to a weaker estrogen. I would do anywhere between 250 micrograms up to 1 gram, but I always go slowly. And if you have a thyroid issue, do not do that yet. Giordana, I'm dairy-free and gluten-free as well. Good. Eat all organic, 2 BMs a day. And then what was your question again? Yeah, so stomach pain. Yeah, so I'd want to go full autoimmune if you can. I'd go full autoimmune because it could be nuts, it could be seeds, it could be nightshades, it also could be eggs. So go full AIP. CW writes, it is bromelain good for digestion? Yeah, that's an enzyme that's found in pineapple. It is excellent for digestion. Awesome, y'all. What a great chat here. Put your comments below. I want topic ideas. I want to know what you guys want me to be researching in my spare time so I can get more information for y'all, have good talks. I'm doing more videos, so keep the engagement. Thumbs up. I appreciate it. Give me a share. And I'm on Facebook too. If you're on Facebook and you want to comment more, I got my big screen in my office hooked up to YouTube, so it's easier for me to read the questions. So I tend to answer questions more there. So get on my YouTube as well, justinhealth.com/YouTube. You guys have a phenomenal night and take care.